Action. Hey everybody, I'm Dr. Kotz, and I'm the owner of Monroe Comprehensive Laser Center and Laurie Kotz, MD, PC. I am an obstetrician gynecologist who also specializes in aesthetic procedures. We do a wide range of laser procedures, everything from hair removal to facials to wrinkles to rejuvenations, and we also do CoolSculpting at this time. We also offer genital plastic surgeries such as labiaplasties, vaginal reconstructions, and more at our office. Tonight's event is centered on our CoolSculpting services, so I thought we'd start off with a little what's the background, what's CoolSculpting all about, and let's see if you're interested in getting something. So first of all, CoolSculpting. The first neat thing about it is this is an actual FDA approved way to non-surgically and permanently get rid of fat. And I don't think there's many of the things out there that can claim that. So there's hardly any downtime. Like I said, it's FDA approved, which is not the case with a lot of aesthetic procedures and off-label procedures that are out there. Hardly any downtime, and we can CoolSculpt all over the body. We can do it under the chin, we can do the tricep twins hanging, we can do the abdomen, we can do the love handles, we can do the back fat, the extra boob, the upper flank, the lower flank, between the thighs, outside the thighs, even that little fat pad that's above the knee. All FDA approved to go ahead and permanently remove fat from without surgery. There are multiple publications in responsible, recognized journals regarding CoolSculpting. And as it stands right now, there are millions and millions of treatments that have occurred all over the world. So CoolSculpting, it's kind of neat. So its history dates back, to 20 plus years. There was an observation, there was a group of children noted by some German physicians and scientists that came in because they thought that it would be fun to just leave their popsicles in their cheek until they completely melted. And these popsicles ended up sticking to their cheeks, until the popsicle was completely gone. And what happened over time after that, over like about a 3-month period, is these kids all developed significant dimples on whatever side they left the popsicle in, because the cold from the popsicle had completely denuded and or gotten rid of all the below the cheek fat. So now they all had dimples where they never had dimples before. So fast forward 40 plus years, and we've translated that into cool aesthetic stuff for us. So, not too shabby. So, the thing about CoolSculpting is, let's talk about how it works, right? So, not everybody in this room is an exercise buff, okay? But even if you are, you can exercise till the cows come home and do squats and do lunges and restrict your diet and all that, and there's still certain amounts of fat that will not go away. Okay, so diet and exercise, this is not a replacement for those things. But let's be clear, diet and exercise works on your visceral fat, your core fat, the stuff closest to your body below the muscle layer, okay? Whereas CoolSculpting addresses that subcutaneous fat close to the skin, that stuff where we've all seen folks who it looks like they really should have washboard abs, but they've got that little bit of hanging or those little pouches here and there. That's the stuff that CoolSculpting gets. And it doesn't have to be a little pouch. I'm just using that for demonstration purposes. That is the fat that CoolSculpting targets. So what happens is that water freezes at a temperature that's this low, way down here, okay? Whereas fat will freeze at a temperature that's not quite as cold. But there's a significant enough difference that we can go ahead and freeze fat without damaging the surrounding water-based tissues like your skin and your muscle, okay? So what happens is we go ahead and we freeze that fat, and that freezing penetrates through that subcutaneous fat. Those fat cells crystallize and rupture, and then they rupture additionally with the massage that we do after the treatment, and then your own body sends a signal that, hey, this tissue is not the same anymore, it has to go, and then your lymphatic system slowly clears it out over the next 3 months, with maximum results about 3 months afterwards. And now let's be clear too, that this is a permanent elimination of those cells. We're not shrinking them, we're not squishing them close together, we are rupturing them and they are being cleared out of your body. Okay? So this is actually referring to permanence. So we want to think now, everybody has a certain proportion and distribution of fat in their body, okay? And the number, we're talking just the number of fat cells that we have is pretty much set by the time we're teenagers, okay? And how much we have at any one given part of our body, but it's evenly distributed, pretty much, okay? CoolSculpting, so say this person here in this drawing, it looks like they had CoolSculpting in their abdominal area. So this drawing shows you that we have reduced the actual number of fat cells in that area. They are not coming back, okay? Can you ever gain weight again? Of course you can. Mm-hmm. But you might not necessarily see the effects of that weight gain right where you had your CoolSculpting because you've actually gotten rid of the actual number of cells that were there. Can your hips still get bigger? Can your arms still get bigger? Your chin, other parts of your body where there still are the same number of fat cells? Yes, okay? And then ideally, the CoolSculpting, what I tell patients and what worked for myself is it was kind of like a kick in the butt a little bit to try a little bit harder to be better to my body because I finally saw a result in this abdominal area that I was struggling with so much. And then it gave me a little more confidence to push myself a little bit more and then go on to do better, even healthier things after the CoolSculpting. So, you know, studies we've got so far say that there's up to 25% total fat reduction, which is huge. 1 out of 4 cells gone, right, in that area that you're treating. And we have studies that show the effects even up to 9 years later. That's as far out as we're getting as far as long-term results. Now, of course, if you completely ruin your diet, ruin your lifestyle, CoolSculpting's not going to make you a healthier person or necessarily maintain all the results that you want. There's some effort on your part. But in that area where you were treated, those fat cells that were destroyed are destroyed forever. As I was saying too, you know, kind of just a reiteration, but the best results with everything that's been studied are at 12 plus weeks afterwards. Now, we've had patients, and even with myself, where we see even further decrease at 16 and further out, but as far as study-proven maximal results in a uniform way, that 12 weeks is really a key mark for what you're going to see from that particular treatment. And again, once those are gone, they're gone. They're not coming back. That actual number of cells is gone that were destroyed. Doesn't mean the ones that are left, you can't expand them and do other things with them, but those ones are gone. In this office, we do very specific individualized consultations for every patient that comes in. We literally map out your body like a plastic surgeon. We look at what your goals are. We see how realistic your goals are versus what we can do for you as a team effort to get you the results that you want. So everybody's consult is a little bit different. And the good thing is, too, is that, you know, treatment times, we're talking just for 1 cycle. Now, you may get 2 cycles, you may get 4 cycles or more in any one treatment session, but a 1 single individual cycle treatment time is as low as 35 minutes or as high as 1 hour and 15 minutes, depending on what you're getting treated. That's just for 1. That's not counting multiple cycles. During the treatment, we have you go into the treatment room, and we'll show you that momentarily. And we have a particular procedure bed that we lay you down. We usually pad it with pillows. And, you know, most people start off with their abdominal area. And we go ahead and we prep the abdomen, and we place a really sticky gel pad on there. And the device itself is like a giant suckerfish. We literally activate the vacuum, and we put it on your skin that we're going to be treating. And it literally sucks the tissue right up in there, which is a really weird feeling at first.